Yes, sure. Can you guys hear me?
Yes.
Yes,
Mhm.
we can.
Okay. Hello, everyone. Thank you for joining us today. So my name is Charlie. I am the president for CGHI, the Coalition for Global Health Innovation. So today we invited a group of young doctors with very international backgrounds to discuss their journeys navigating global health and studying medicine and being young doctors in multicultural settings. And today we have Abisa, who is gonna lead the introduction. The interview, and then we have the interviewees, which Abisa will introduce later. Um, Maybe I can invite Yelena to introduce our coalition. Thank you.
Okay, hi everyone. My name is Yelena, and I am currently serving as the vice president of the coalition. So I will keep this introduction quite short. But for you, what you need to know is that Coalition for Global Health Innovation is a registered nonprofit organization by early career professionals for early career professionals in global health. And what we do is we are trying to amplify the voices of early career professionals in global health by giving them a platform where they can share their ideas, their projects, some of their maybe writing and publications, or just a way and a source, a network to connect with others that are also working in the field. Um, I think that is like a very short introduction. What we are also doing, we are very present on our social media where we like to spark up discussion. We also offer articles and publications. We offer internships for maybe students or some early career professionals that need a way to connect. But also, what we are known for is our Action Tank project, which is basically a pre incubator style project where we help early career global health professionals or maybe just someone with an idea to kind of form it and present it. In order to create a healthy space somewhere in the world. Charlie, if you want to join and maybe fill in something that I've missed, please feel free to join.
Thank you. Thank you. So yeah, I don't have much to add, but I will invite everyone to check out our website, coalitionghi.org, and our Instagram, Facebook, Twitter, LinkedIn, YouTube. We're on every platform. And we are having a continuous discussions with young professionals. We have our young professional series. So please follow us on our social media and you will be updated. So thank you, everyone. Over to you, Abisa.
Hi, everyone. My name is Abisa. I would firstly like to thank CGHI for the opportunity and for giving us the platform for us to come together today and speak a little bit about our opinions in the topic of global health. Today, we will be giving continuity to the series of young professionals, as Charlie mentioned. This is our second episode. I will highly urge you to go and have a look at the first one, which was a conversation regarding development policy in global health with Kale, one of the collaborators, which was quite interesting. And if you're particularly interested in this topic, I think it could be very valuable to you. Today we will carry on the series. As I've mentioned, we have a group of recent graduated doctors, and we are going to discuss what we think is the role of a physician in global health, and also medical schools and medical education in shaping a little bit our perspectives of in the topic. I will start by giving a small introduction of myself, what do I do and what my interests are, and then I will give the floor for the rest of the participants to do the same as well. Um, my name is Abisa. I am based in Portugal. I am a recent graduated doctor. And at the moment, I'm also doing a master's in global health and international health. And I am also currently studying to continue my training and do my specialization program. I think that the question of why did I become a doctor, it's a ever evolving one. So the taste for science, the enjoyment and how rewarding it is to work on a daily basis with people, and it changes constantly as the problems of the world also change. In terms of my interests in public and global health, I would say they would be mainly tailored to health inequalities in developing countries. Most of my projects at the moment in my master's have been regarding that. And it just makes my participation with CGHI quite interesting because I get to learn more about the topics and also network with different professionals in the area. So that's a little bit about me. I will then pass the floor to whoever wants to go after me.
I can go. My name is Anna. I'm a recent graduate as well. I just graduated in July. I am from Canada, but I'm based in the US. Um, Reason for me being a doctor, it's the love for science was always there because I was part of the 6-year MD program. So my views on or outlook on medicine from when I was 18 to 23 has drastically changed. But I'd say the love for science and the need for some sort of social work activity. Medicine was a good blend of both that I liked when it came to choosing a profession and working towards just being there and doing like a service-based profession. In terms of topics that I'm most passionate about, definitely the surgical aspect of things when it comes to medicine. A couple of topics that I've looked into and I'm trying my best to form my portfolio along the lines of are global surgery, rural surgery, trauma, and surgical oncology, specifically focusing on communities that have very barely have any access to surgical care. So that's where I'd like to lead my profession to. So that's me. That's a little bit about me. Whoever wants to go next.
I can go next. So I'm Sarah, and I'm from Canada and currently based in the US, and I'm a recent graduate as well. In terms of the question of why did I choose to become a doctor, obviously the answer changes over time, but for me, I've always been fascinated by the idea of cardiothoracic surgery from a very young age, and I was naturally drawn to it. And the idea of being academically challenged in terms of dexterity and also in terms of problem solving on a day-to-day basis really compelled me to become a doctor and try to pursue cardiothoracic surgery. And I've also been volunteering at hospitals from a young age in both Canada and the US, and seeing the patients go through the whole process of surgery and treatment. And after that, the post-op period and the recovery was quite gratifying for me to see. And also the satisfying aspect of meeting the needs of the patient and their families had also allured me into pursuing medicine. And topics that I'm very much passionate about in global health would, of course, be cardiovascular diseases, which is one of the leading causes actually of death globally, with heart attacks and strokes being one of the main causes of cardiovascular diseases. And also mental health is another one. Who would like to go next?
I'll go next. Sorry, mute everything technology. But my name is Kaivalia Talam. I'm from California and I'm based in the US as well. And for me, the reason why I chose to become a doctor is the old adage, as everyone says, interested in science and then straight pathway into medicine. But overall, I'm passionate about working with kids. So that sort of led into the natural progression of wanting to become a pediatrician. And in global health specifically, I'm very, very interested in specifically the World Pediatric Project, but essentially also providing just specialty care to children in impoverished countries, just building pediatric healthcare networks overall globally through different global partnerships and so on and so forth. And then also climate change in the sense of global health. I'm extremely passionate about. There's a lot that climate change, when you just look at prevention and stuff, I'm very passionate about looking in that perspective in the sense of global health as well.
Thank you for introducing yourselves. I think it's always very thrilling to hear everyone's motivations to be in the medical field and what are their perspectives for their careers, and so it's always lovely. Um, we are now going to introduce the section of question and answers. And I think that the very first question that I would like to make to kickstart this part of our small discussion is for you, Sarah. Um, and since we are talking about this as our main topic, what do you think, what would you say that is the main role of a physician in promoting public health and global health, not only in their community, but also in a global scale?
So in my opinion, physicians promoting public health or global health should use data, evidence, research, and education, and also public engagement, and most importantly, preventative care, all towards the ultimate goal of building healthier communities. So these communities that are prone to chronic diseases or forced to depend on an already overburdened health and social support system for their care and well-being should be targeted by these physicians. And I believe that these physicians interested in public health initiatives should focus on identifying or responding and addressing these negative factors that affect population health, such as poverty, for example, or people with addictions, or people living in isolation or marginalized communities or in remote communities who do not have access to public health care systems. And this would definitely have an enormous impact in the longevity of the citizens of that targeted community. So as a medical student during my cardiology rotation and surgery rotation, specifically in Texas, I came across physicians who had patients with cardiovascular diseases. And the physicians I rotated with, they basically emphasized the importance of reducing risk factors associated with cardiovascular diseases. And they were more focused on the preventative care aspect of medicine rather than using medications right away. And they waited to use the medications as the last resort, with preventative care being the most important thing that they emphasized on. So patients were encouraged to maintain a healthy weight, have a well-controlled diet, and cessate or avoid smoking and alcohol, and include regular physical activity over having a sedentary lifestyle. So all of these, and some patients had certain determinants such as poverty or stress or easy accessibility to unhealthy food, especially which is kind of common in the America or the US, where most unhealthy food is very cheap and easy to access. So, and also people had some patients have family history of cardiovascular diseases, which also made them prone to having cardiovascular diseases. So this is an example where the social, economic, and cultural changes are all factors that directly contribute to cardiovascular diseases. So most cardiovascular diseases, as I mentioned, they can be prevented by addressing these modifiable risk factors, such as smoking or alcohol cessation or well-controlled diet. And the physicians that I rotated with helped the patients come up with a plan involving SMART goals. So SMART goals is it stands for specific, measurable, achievable, relevant, and time bound. So these goals were made by the patients, and the physicians sat down with them and came up with a plan to encourage and help patients and to help them with their cardiovascular diseases, and almost as to promote preventative care or take preventative measures in terms of cardiovascular diseases. So I think physicians should focus mainly on preventative care these days, more than the actual aspect of using medicine to deal with cardiovascular diseases or just any diseases in general.
Very insightful, your answer. I think that I completely agree with everything that you've said. And people often have the misconception that the patient-doctor relationship starts and ends within the hospital setting, or if you're a GP practitioner within your GP practice, but it actually
Hi, Abisa. I think you're frozen a little bit.
am I
Yeah, maybe you could repeat what you just said.
Yes, so what I was speaking, is everything okay with the connection now?
Yes.
Yes.
Yes. What I was mentioning was that the patient-doctor relationship goes further along than just the relationship they have within the hospital setting. Preventive care involves a lot of understanding the social, the cultural, which then in global health, we speak about the social determinants of health that
I think you froze again. Maybe we could turn off our camera for just 1 minute. Maybe that help a little bit, just for now. Yeah, thank you. Go ahead, Abisa. You are on mute.
Okay, is it better
Great.
now?
Yes, thank you.
Okay, so I was just saying that with speaking all of the social determinants of health that Sarah mentioned quite a lot whilst answering the question, it's quite important, and therefore medical schools, is everything okay?
Yes, yes.
Okay. And then,
Maybe sorry to interrupt. Maybe you could repeat this section and then we'll cut out the rest.
okay. So I was just thanking Sarah for answering this question, and I think that oftentimes there is a very big misconception that the patient-doctor relationship starts and finishes within that consult or in that hospital visit. And often doctors, and in order to be able to practice effective preventive medicine, need to be able to understand all of the factors which in global health we normally speak about, the social determinants of health, it being political, cultural, which Sarah spoke about as well. So broader societal and cultural considerations. As such, I think that medical schools also play a very important role in shaping the perspective of young physicians in health disparities or public health context. And so, Anna, do you think that the medical school curriculums cover topics related to public health, and if they prepare us either by delivering specific courses and experiences that would then further influence our practice of health care?
In terms of if our medical school curriculum adequately covers these topics and topics related to public health and sociology, I could speak in two terms because I was part of the six-year MD program, and I also had colleagues that joined me when I reached second year, so they're 4-year MD program. So in terms of your 6-year MD program, we did have a course in second year called sociology. It touched base on social constructs pertaining to healthcare in Poland specifically. We went over population graphics, and there was a very brief introduction to public health, but there was no continuation into the rest of the years, which was unfortunate. It was quite unfortunate that there was not really a continuation of these topics into the rest of our studies. But when it comes to the 4-year program, unfortunately, from the curriculum, there's not much exposure that these students get to in terms of discussing topics related to global health and public health. And there's no specific course that's assigned or graded during our theoretical years that, where kids get exposure or students get exposure to these kind of topics. So as medical students in our curriculum specifically, if you were interested in public health or global health topics, it had to come a lot from your own time, and it had to come from a lot from your own incentive towards these topics. So if you wanted to work and if you wanted to shape your career in such a way, a lot of our medical students do join nonprofit organizations, and they join all these social clubs that are not part of our faculty, so that they can get more involved in these. So personally, if I were to put my opinion on this, I would say that I would love to see medical schools start courses that are part of our curriculum where we integrate more of these kind of experiences and exposures for students to be ambassadors or advocates towards certain global health topics that they're passionate about. I would love to see a course during our clinical years where we focused on the public health topics such as immunization. So during our pediatric rotations, we were out there, we're exposed, and we work with let's say pediatric patients and making sure that their immunizations are on track and on record, and like, the consequences of that, etc. Because these kind of topics are not really, it's not something that is part of our curriculum, unfortunately. But in comparison to previous medical students and us, we are a rare case where it was during our theoretical and clinical years that COVID-19 pandemic hit. So a lot of us students were forced to face topics such as global security and the realms of communicable diseases. So that was, I would say, as much as of a big of a con that it was also a pro for us in terms of our studies, because a lot of us had to go through the pandemic during our studies, and teachers were sitting us down and starting to teach us the importance of global security and trying to take care of yourself and the dangers of communicable diseases, especially in such a big scale such as a pandemic. And to go off of your second question you had for me, where if you can share any specific courses or experiences that I've had, in terms of my medical school career, I knew around third year that I was quite passionate about the global aspect of things, specifically global surgery, and working with patient populations that are under in what would be considered a low socioeconomic status. During my pediatric rotation specifically, I worked with one of the doctors who also worked with a social service agency. It was a nonprofit organization, and it had an emergency shelter, it had an international program, and it also had a community-based program for pediatric patients where they were crossing the US border as refugees. So it really opened my eyes and broadened my thought process in terms of how important it is about immunization when it comes to these kids, how important it was for the communicable diseases spreading, especially because a lot of my pediatric population were from the South Americas, and this was their first introduction into coming into the US, and how on top we had to be with making sure that they're healthy and making sure that they've got all their immunizations on track and making sure that they were given proper health care in their countries that they were coming from. So it really opened my eyes into how important it was that a lot of our global population do not have access to what I would consider a very basic healthcare necessity, unfortunately. And in terms of how this influence has how the last part of the question where you were asking how this exposure influenced my perception on healthcare, definitely the number one thing that I started to notice among a lot of my patients and their cases were their lack of access to basic healthcare needs, and especially surgical care. So I saw a lot of pediatric patients that had come with fractures and breaks, and they were left untreated for years, and that caused them to have a certain type of gait, and it could have been a fracture that could have been easily fixed in their childhood, but now they're well off into their teens, and it's just been left untreated. I've seen a lot of untreated hernias. I've seen a lot of infections that could have definitely been prevented if there was that initial immunization or initial care that could have given to that patient. I do know that vaccinating children is a controversial topic in several countries, but definitely working with especially these children that were coming from the border, I definitely saw the importance that global healthcare and global surgery needed to. It's a huge need in South American countries specifically from my patient population that I was working with. So that's me.
Yes, 100%. I think just touching a little bit more, let me put my camera on, just touching a little bit more on the medical curriculums and also sharing some of my experiences. I've recently come across actually this study that focused on integrating patient-centered clinical scenarios which also came across when COVID hit and we weren't able to have the exposure with patients, in which they addressed and used that opportunity to address some of the cultural differences that we can have with the several different patients that we encountered in clinical practice, and have several benefits, but one of the ones that I can think is that it can help us enhance our cultural communication competences. Medical schools do have certain opportunities. For example, there are a lot of exchange programs in that sort. I personally was able to benefit from the Erasmus program that is confined to Europe, in which it's not just for medicine, in other subjects as well. And it's quite beneficial. I think it helped me in my practice in the sense that you have exposure to different healthcare systems, different ways of practicing medicine, and also all of the other determinants that affect the care of the patient. For example, I was able to contrast between Poland and France, which was the country where I did my internship, where their economic power reflected in not only the resources that they had within the hospital setting, but also how the patients had their behaviors towards their own care and their own health. So these are things that I would advise medical students to look into, and we will further develop when we speak about the careers opportunities that we have later on. But with this being said, I think, Anna, I will carry on discussing this part with you. Do you think, if you came across any specific challenges that you think they would have been better addressed if medical facilities or medical professionals were better trained culturally to address the cultural differences?
For sure. Keep in mind, I did my training in Poland. So I did my theoretical years in Poland, and I did my clinical years of my medical school. So my last 2 years of clinical rotations, I was able to do it in the US, specifically Southern Texas. So, and then my summer internships were done in other parts of the US. So I started off one summer in New York. I did another summer in Miami, Florida. And I also did a couple of summers in India, specifically Southern India. So Telangana and Kerala. So the different exposures to all these countries in different parts of the same country makes a huge difference in how healthcare is done in how it's provided to these patients. One example that I could think of is specifically translation devices during patient care. It's drastically different from country to country, and a personal opinion of mine is that patients, like that's just the setting or the environment in a room drastically changes when there's an active translation device where the patient is able to communicate properly, versus countries where I've seen where a lot of the information is missing, and there's a big fuzz over when there's a conversation that's been happening. And a lot of these conversations that we're having in the hospital are not your day-to-day conversations that you can use slang and get by for the person to understand. A lot of it is medical terminology that's being used and that needs to be translated properly. So these conversations are much more weighted and require a translation device, in my opinion. So when it comes to the US, I have seen most of the hospitals, or the hospital chains that I've worked with, have hospital translation devices that are HIPAA compliant. So HIPAA stands for Health Insurance Portability and Accountability Act. That's part of the US. So it just provides the patient with patient privacy and making sure that all the patient information stays within the professionals and the patient that are working with them. So it's HIPAA compliant, and these translation devices or these translators are not only language experts, but they're also medical experts. So they're well versed in their medical terminology that's being translated back and forth between these languages, and they definitely cater to the diverse needs of our population. US being every single main city has over 25 languages that are almost spoken equally in terms of the population. So it really requires hospitals to have these translating devices. And on the counter side, I've seen in, for example, Poland, where translation devices are not actively used in the hospital setting. And not only does this cause a barrier between the patient and the doctor, but also creates a barrier between medical students like us who are in the training setting, and especially international students. So if they were to have some sort of translation device, and when I talk about Europe, it doesn't have to be translation companies that work within over 25 languages. It could literally be the neighboring countries and their languages that we're working with. I definitely think that it would allow a better training facility for the healthcare providers. It would allow for more active and engaging learning environments for the medical students themselves, so that we're not lost during our clinical practice. I think it makes a huge difference when it comes to the comfort of a patient. Patients are more likely, I have seen that patients are more likely to respond better, and that we're able to take a better history with patients whenever there's a translator between us. Myself, I am not fluent in Spanish. My fluency is in English, Malayalam, and French. So for me, I can understand these languages and take a patient history in these languages. But when I was working in Southern Texas, a lot of my patient population was in Spanish. So I really benefited from having a translator that I knew was HIPAA compliant, that was a medical expert, and I was able to trust them in order to make sure that my conversations were, carried on thoroughly and properly. So I definitely think translation devices are a huge play in terms of experiencing, making sure that the cultural differences are sorted out in a medical setting. Another thing that I would say that I've noticed is also specifically pertaining to my training in India versus the Western countries. It's the idea of having a blood group stated on your official IDs. In India, especially Southern Kerala, a lot of the students coming into school, they're taught their blood group. So it's something that's like almost taught as part of their identity. So if it's like, Anna, your blood group is B positive, and like make sure you know that it's on your health ID, it's on your official IDs. And I think that played a huge difference in emergency departments in trauma surgery, which I don't really see in the Western countries. And I feel like we would save a lot of time on in treatment, because blood typing is not part of the initial blood workup in a US in a trauma setting. So I think that we also save a lot on time if blood if this was an idea that was brought up. So I would say little difference like that make a huge difference when you're working them in different countries. So yeah.
100%. It's quite interesting that you've mentioned the translation devices and you've made the contrast between the US and Poland. Unfortunately, we've recently had the Russian-Ukraine war, which led to a lot of refugees coming into Poland. So during our practice, we would have to also provide care for Ukrainian patients, and the linguistic barrier was one of the problems, and the fact that they didn't have those translation devices made it quite complicated to provide comprehensive care to the patient due to the lack of communication. Luckily, there were some healthcare professionals and even students that were able to do that, but in situations where critical care has to be delivered, it can definitely compromise it. Another topic that I would also like to introduce is the idea of pandemics. We have recently experienced COVID-19 as one of the major pandemics recently, and it has highly emphasized the interconnectedness in global health between different fields. And so, Sarah, I would like to ask you, in what way do you think that medical schools can prepare students to mitigate and prevent the issues related to infectious disease in a global scale?
In my opinion, I think medical schools should implement public health courses as a mandatory course throughout all years of medical school, rather than public health just being a brief introductory course. And I think that these courses should entail the preventative measures related to the specific pandemic diseases in general that we're experiencing globally, and also endemic diseases that are prone to that community or that region. So in Poland, when I was doing my medical school, within the first 4 years, we had a course called sociology, which was basically public health, but it was only taught during our second year of medical school, and it was a brief introductory course. And it was not in detail. It was not a course that was taught in detail, and I wish that it was taught in detail. And I do believe that this course is something that should not just sociology, but public health courses should be something that should be taught in almost all medical schools, and not just in 1 year, but like throughout the entire course of medical school. And it could be built up as an introductory course in the first 2 years, and then eventually it can go into more detail as you go through the years of medical school. So in our, I went to the Medical University of Silesia. So we had an international program, a European program, and a Polish MD program, and both 6-year MD program and a 4-year MD program. And I was part of the 6-year MD program, the international MD program. So I do think that within the programs itself, for example, the international program should have the public health courses related to the public health courses should be taught in terms of global pandemic diseases and also endemic diseases related to the US or Canada or wherever the students want to eventually practice. And in terms of Europe and Poland, I do think those programs should also implement public health courses related to the endemic diseases of that region or in that area. And also, I do think that medical schools should develop programs around educating medical students about these public health diseases or these topics, and they should be taught by simulation or by role play or training or even online and face-to-face lectures about these public health issues or these public health topics would encourage medical students to be more active and proactive, and especially when certain outbreaks or emergencies happen, they're able to volunteer or like be working up front and able to help patients with these certain diseases. And also the education on importance of hand hygiene and masks are very important. And I think after COVID, everyone started to be more careful about wearing masks and using and the importance of hand hygiene. So I think these are all things that can ensure that medical students are well prepared to respond to emerging infections.
Thank you, Sarah. I think we've touched in very interesting and proactive ways that medical schools can influence how the overlook that medical students have in global health. And when we speak about global health, we often tend to think about communicable diseases, so all of the cardiovascular diseases, diabetes, etc. We think about infectious diseases like COVID that we've just recently mentioned, maternal and child health, but we tend often to neglect things like climate change, for example, and the impacts that climate change may have in healthcare and in the health of each person individually and also in a global scale. And so, Kevalia, I would like to ask you your intake in the issues that that climate change may pose in health, and also if there's ways that students and healthcare professionals can educate themselves and the others in regards to this in terms of the general public as well.
Well, thank you for the introduction for that, Abissa. And essentially, we all understand that climate change has very far-reaching impacts on global health, on the health of the world, and these changes in temperature, the extreme weather events, these shifts in disease patterns, disruption to ecosystems. I can go on, but essentially all of these caused by climate change can directly and indirectly affect human health. And that is one of the main things when it comes to these conferences about climate change and educating people that human health is a very, very big portion in when it comes into consideration for drafting notices and essentially policies. We take into account human health. That is one of the biggest factors. And some key ways in which climate change impacts global health is heat-related diseases. That's a direct that's a direct health effect of climate change. You have vector-borne diseases. So you will see changes of more mosquitoes, which carry diseases, rats, which carry diseases. You'll have your air quality and respiratory issues that cause problems. In fact, specifically in Katowice, where I studied medical school, it was labeled as one of the worst polluted cities in the world, to the point where actually the World Health Organization in 2018 came to Katowice, Poland, while we were all studying there to hold their COP24, which is the 24th Conference of the Parties to the United Nations Framework Convention on Climate Change. And in the previous COP, which is COP23, which was held in Fiji, I believe, they wanted a special report. So this during the COP24, they launched a special report on health and climate change during the side event at the COP24, which essentially just showcased and essentially provided a global state of knowledge of the interconnection between climate change and health issues, and an overview of initiatives and tools through which the public health community at county, regional, and global level is currently supporting to scale up actions to implement the Paris Agreement for healthier overall society. And during COVID-19, actually, it was stated that with the heavy protocols on lockdown, you saw that just the immediate impact of lack of pollution and watching the world just grow healthier during those few months that everyone was on lockdown. So it is essentially demonstrated that with proper support and with proper push for these sort of recommendations from these people from the World Health Organization, that we could lead to a much healthier climate. But at the rate that it's going, it's already been like put that we are at an irreversible point. And I don't think people are understanding that enough. We are already at that irreversible point. As healthcare professionals, it is now our duty to just, in our societies and within our own practices, once we get there one day, just to implement sort of effective adaptation, just to put and reduce the risks of climate change in the sense that you personally recycle more, educate your fellow people and peers on the effects of climate change and what they can do to essentially play their part in helping mitigate the risks of climate change, endorse healthy behaviors and strategies with low environmental impact, and support intersectoral activity to reduce the environmental footprint of society in general, and particularly in the healthcare system, just strengthening infrastructure in healthcare. So proper training for healthcare workers and ensuring the availability of medical supplies during emergencies, promoting policies and supporting policies that prioritize public health and climate action at local, national, international levels. So be aware of what's going on, look into what's happening in your local governments, and support anything that has to do with climate change. And these efforts can protect global health and have an overall healthier population.
Thank you, Kevalia. I think that you have very rightfully so highlighted the interconnections that we require in terms of collaboration between different healthcare professionals to handle some of the topics or health-related challenges, and climate change ends up being a very pertinent one in the sense that we require climate scientists, epidemiologists, environmental health scientists, and even doctors and health educators. So in that sense, it kind of opens up the floor for discussion for the career options that we have in global health, not only as medical students, but also as any other healthcare professional. With this being said, just speaking a little bit in terms of the studies, as a medical student, the things that you can do, obviously we've touched in the exchange programs that are available within your university. And for example, if you're based in Europe, we have things like the Erasmus program, but also there's student association, international student associations like the IFMSA, the International Federation for Medical Students Association, that have also global health exchange programs, where I think that one can be more internationally. It helps medical students have a different perspective of health, the differences in healthcare delivery as well, and all the conditions that can affect ultimately health. And also, I think that you have opportunities such as, for example, enrolling in international NGOs. We have more within a medical practice, speaking about the Doctors Without Borders. That's very common and that people know a lot about. Nowadays, there's a lot of different postgraduate studies, for example, in health relief and humanitarian crisis, if you want to have a more hands-on impact in global challenges, and also global health research, which is equally important. And I think as a medical student, this is something that you can benefit more of, in the sense that also I would emphasize the need to put yourself out there and to ask about these opportunities with with the doctors, your tutors, because a lot of times there's research that's based within your university. I will exemplify with Eurosearch, for example, which is an association of medical students and researchers that work overall to develop research skills with medical students. And you can, for example, have the role of a data collector. They recently had an Apollo study which was focused in colorectal cancer. Great ways for networking, and quite interesting if you are specifically passionate about research. You can, as we've spoken about and we've touched about in the last series, you can be involved in global health policy and advocacy, which oftentimes being involved with the NGOs would help. But I think that overall this would be something more related to medical students and medical practices. But I think when it comes to global health, we need to think more outside the box and understand that there are different healthcare professionals that are also involved in this concept of global health. We have, as I've mentioned previously, epidemiologists, researchers, even people that have more of a diplomatic take on things and policy making. We have pharmaceutical professionals, and this kind of brings me on to Yelena. For example, this is your area of expertise, so you would be able to speak more about this this area, but you guys also have a very important take in global health.
Yes, thank you, Abisa. Well, first of all, I feel very honored to have been here and just listen to everything that you shared. And I think from my perspective, so just a quick introduction, I am on the way to completing my pharmaceutical studies in Serbia. So I feel like a lot of the topics that you mentioned, I definitely agree with and still are pretty relevant, and the situation is pretty similar in Serbia as well. So from my side, I definitely agree with all of the suggestions and career options that you mentioned. I think that even from the perspective of a rising pharmacist, I think that there is definitely a lot of exchanges where you can kind of get the opportunity to see how the situation looks like globally in different countries, in different areas of the world. So if you really want to learn firsthand about how global health, or rather health, looks in different parts of the world, that is definitely my go-to suggestion. Also, I think some of the universities, at least mine, we also have an opportunity for students where they can join a student journal club. So it's almost like an extracurricular activity where you get to explore the topics that you really want to learn about and are passionate about. I think that global health in some countries is a pretty new field. I know that in Serbia it is as well. We don't really have like a formal course on it. We do have a public health course, which is an elective. But I think that also opens like more doors for students to collaborate with their professors and maybe engage in some research, because that is maybe the best way to slowly get to know like the global health field. But speaking from my own experience, I know that how I got introduced to the global health field is by joining CGHI myself. Obviously, you have a lot of topics that we cover at universities, at our courses, at our extracurriculars. But I think that the greatest way, and maybe the greatest way to like connect with other professionals across the world, is our nonprofit organizations, or just some organizations that deal with global health. It is how you build your network. It is how you learn about different topics, in case you're not maybe able to formally study something. But I definitely think that my advice for students would, or early career professionals, would just be to pursue your interests. So if you're interested in something, if there is a topic, or if you're very passionate about global health, I think that just searching and browsing and looking for different opportunities, like you have to motivate yourself to start looking, and just developing as an early career professional. So those are some words from me.
Thank you so much for your take on career options in global health as well, from a perspective of a future pharmacist. I think that we will very soon be wrapping up if no one else has any questions or has anything else to add. I think it's been very insightful to hear all of you guys' opinions and advices that students can take for their future, and also that would help them shape their careers. Looking forward for the next episodes of the Young Professional series that we will be having. This one will definitely also be going to the YouTube for everyone to see and have access to. Well, just want to wish you all a very good day and see you soon. Okay.
I'm inviting everyone to turn on their cameras and then we can take a screenshot. I invite everyone to take a screenshot because
I think it's just missing Kevalia.
We are missing Kaivalia. There you go.
I don't know if everyone can see. Can you guys see everyone? Because I can only see, no, I can't. No, because I keep missing one person. Wait, maybe it's because I need to. Can you see everyone in the screen?
I
I
can.
can.
Okay, then I will let you guys take the screenshot because I can only see 4 people.
Okay, sounds. If everyone's got their best faces on, I'll take the screenshot.
Go ahead.
Perfect.
Okay, I've got one.
Perfect.
I've got one, so.
Great. Thank you so
Perfect.
much,
Thank you.
everyone.
Thank you so much for
Thank
inviting
you.
us for this conversation.
Thank
Really
you so much,
Yeah,
guys.
It was a pleasure to see all of you guys.
Thank
It's
you. I
amazing.
think it went great. I love, I did not study medicine or pharmacy. I studied politics and now I'm studying development studies with a focus on gender and decolonization and marginalized groups. So my engagement with global health is more like advocacy, activism, and project management, and helping to build communities like what we do at CGHI, empowering young professionals. So I've learned a lot from this conversation. Thank you so much. And you all did so great. And would love to stay connected with you guys.
Sure, for
Just
sure.
just a quick word from me as well, if I can jump in. I know that Charlie's point is obviously a bit different, but from myself, I mean, pharmacy is close to medicine in terms of like studying and everything we study. So I definitely think sometimes like every time I talk to like medical professionals, I'm always surprised to learn just how similar of a situation it is everywhere. So I know that from my side, like now that I'm finishing my studies, it's like I'm so sad that there is like no global health course, that there is no way to like connect with like-minded people. But seeing just that on a global scale, there is so many students and so many professionals that have been like through the same path, it kind of gives me hope that there is also so many passionate people about it. And even if like you don't have courses to meet and to like connect with each other, there is always a way to like connect in the end. And I think this event also highlights that, because like obviously I was familiar with everything that you taught, but just listening and hearing things from your perspective, again, it's I learned a lot through it, and I definitely think that if there are any like medical students watching this afterward, that they will be learning a lot too, because sometimes we lack this perspective and maybe just the encouragement of like professionals in the field and working, but just listening to you and getting to be here with you is really a privilege. So thank you for joining us, and I would definitely, like in the future, if we have some projects, we'll have you in mind.
For sure. Thank you so much,
Thank you
guys.
so
Just
much.
just thank you so much. And it's crazy to think that about like 3 years ago, I was in Abyssa's dorm room, and I was just like, we've had conversations about, what are we going to do in the future? And we were discussing about like global health and, how we would get out there. So when she did invite us, I didn't even, I was studying for my licensing exams, and I was just like, you know what? I don't care. I'm going to do it. Let's go. It's like our first postgraduate, like, venture together, if you want to say. So I was just like, yes, for sure. So thank you so much for the opportunity, guys. And I'd love to keep in touch. So
Of course. Thank
Yes,
you.
I just wanted to say, Charlie, Anna showed a lot of interest in participating with Coalition, so I will definitely give her all the details, and then you guys can speak, and maybe she can even come in the next meeting that we have. Sorry that it took so long to get this one together, but as you can see, like just the busy schedules and everything. So hopefully this meeting will be of use to anyone that sees it afterwards, and they can take their 2 cents out of everything that we said.
for sure. Thank you so much,
Thank
guys.
you, guys.
Thank you.
Thank
Well, good
you.
luck and soon.
Love
Thank
you.
Yes,
you.
good luck with your exams.
Bye.
Bye. Thank you.
Bye bye.
Bye.